So this is my 6'4" client who drove up from Amarillo to see me at the Hesch Institute in Aurora, Colorado. And you've had lots and lots of chiropractic. You saw 4 different chiropractors?
Right.
Over the period of how many years?
4 years.
Yeah, yeah. And then you also had several months of physical therapy.
Right.
Okay. You feel like your head is forward, am I correct?
Yeah.
Okay.
Like a nerd neck.
Uh-huh.
type.
Uh-huh. And did you ever feel like it got straight?
It was normal as far as I could tell. I just don't know what normal is, so it's hard to say.
Okay, all right. And who taught you exercises for your forward head?
YouTube.
Oh, okay.
Nobody really addressed that.
Okay. So can you show us what you do for it?
That type of
So you do retractions?
straight against, make your back flat with your neck against the wall.
Okay.
Hold that for a while, or
Very good.
keep bringing it forward and back.
Yeah, yeah. So how long have you been doing those?
A year.
Okay. And how often do you do that?
When I feel like it, and there's no real
Yeah.
structure to it.
Okay. And when you do it, how many of those do you do?
Just a few.
Yeah. Yeah. What's a few?
5.
Yeah. Yeah. Alrighty. Okay.
It's more of a stretch, I think.
Yeah.
for
Yeah.
me.
Okay. Go ahead and stand sideways. And I don't believe that you can tell that someone has a forward head by lateral posture. I just don't believe that because there's enough variation from person to person. So I don't really use that to discern, that their head is forward abnormally. Okay? But what I did find with you, let's go ahead and have you lie on your back. What I did find is that when I do traction that isolates the upper cervical, the first 2 joints are forward, the rest of the facet joints are in the back of the neck. So when you do traction through the occiput, you're capturing mid and lower cervical. But if you want to isolate the upper 2, where the occiput connects to the first vertebrae and then the first and second vertebrae, called that lanoaxial joint, then your contact needs to be in front of the ears. So my palmar contact is there, and what I'm doing is I'm pulling with traction to take up the slack, and it takes up kind of quickly. Okay, but I'm still able to get some spring mobility. It feels less than normal. So I'm going to call that mildly, or mild to moderate minus hypomobile. Okay, and when you do that traction, you should be able to take up the slack. So you pull with about 15 pounds of force to a stop point. And I've done lots of practice with fish scales to develop my innate sense. But actually you adapt the amount of force to each individual. But you should see the whole body move. And when you do the traction, the thrust after that traction, you should see the feet move, and I don't see that. Okay? When I take you in flexion, so this is perhaps 15 degrees of flexion, and I do the same thing, okay, I can take up the slack, and then I can spring you, and I see a little bit more motion. Do you feel like there's a little more mobility in flexion?
Right.
Okay. Yeah. Now when we take you in about 10 degrees of extension, it gets interesting. So now I can't even take up the slack. With a reasonable amount of force, and even if I'm very careful to replicate the same angle, parallel to your head and neck, I cannot take up the slack and I cannot spring it. Okay? So I suggest that your nervous system has adapted to this, and maybe it was from a trauma or maybe from habit, who knows. But the muscles seem to be holding your atlanoaxial joint into hyperextension. Okay? And I've treated this with soft tissue work and exercise and not been very effective. I'm suggesting it's the atlanoaxial joint for the simple fact that we have spring mobility at the occiput. I'm going through the mastoid, which is part of the temple bone, but going through that to the first joint, and we have very minimal rotation. That's probably 3 degrees, maybe 5 degrees of rotation, and that's what that first joint has. And then I test side bending by lifting up my finger towards your ear, and you have that slightest amount of initial movement. So I don't think it's the joint between the head and the first vertebrae of your neck. I think it's the first vertebrae and the second vertebrae. And when I come now on the outside of the first vertebrae, I'm on the transverse process. That's a bony, that's definitely bone, right?
Mm-hmm.
Okay, so now I try and shear it to the left, and I try and shear it to the right, and it's very tight. When I come down to the second vertebrae, now we get shearing mobility to the left, and I can take up the slack going to the right, and I can shear it then. The other test I can do is I come underneath here, and the prominent vertebrae is the number 2 vertebrae, and I can lift that up and your head moves. But when I come above that and I flex your neck just slightly to make sure, and I'm right below the occiput to make sure I'm under C1, I'm trying to lift up with my middle finger and I'm getting nothing. Okay? When I try and lift your neck, I get nothing. Okay? If I flex it a little bit to go to the next joint, then it's easy to lift your head up. But in neutral, I cannot freely lift your head up. Okay? What I'm going to do is treat it with traction, isolating the upper cervical. So I'm going to put you in 15 degrees of flexion, and all I'm going to do is make that same contact, and all I'm going to do is replicate the angle of your head and neck with my forearm, and I'm going to take at the slack, okay, and I'm going to maintain that. But actually on further reflection, I'm going to come closer to the restriction, so I'm going to do it only at 5 degrees. Okay, and so take at the slack, and I'm going to stay right here. Okay, so we'll stop filming here, and then we'll come back and refilm it in 2 minutes.